Today we're going to be talking about the amazing field of music therapy and how it can be used to help people of all ages and abilities. We'll include studies to back all of our claims. First of all, what is music therapy? It's the clinical and evidence-based use of music interventions to address physical, emotional, cognitive, and social needs of individuals. In other words, music therapists are trained professionals who use music to help people feel better and improve their overall quality of life. Music therapy can be used in a wide range of settings, such as hospitals, schools, hospice care, rehabilitation centers, and mental health clinics. It's been shown to be effective in reducing anxiety, depression, and pain, as well as improving communication, mood, and overall well-being. One study conducted by the University of Toronto found that music therapy was effective in reducing anxiety and depression in cancer patients, where they all participated in individual music therapy sessions once a week for 6 weeks. The results, measured by anxiety and depression assessments, showed that music therapy was associated with significant reductions in anxiety and depression, as well as improved quality of life. Another study by the University of Melbourne found that music therapy was successful in improving communication and social interaction in children with autism, using the same schedule that the University of Toronto had, attending once a week for 6 weeks. The results showed that music therapy was associated with significant improvements in communication and social interaction, as well as reduced problem behaviors. They measured the results using standardized assessments of communication and social interaction, as well as observations of problem behaviors. The University of Queensland in Australia examined the effectiveness of music therapy in reducing PTSD symptoms in military veterans. In this study, military veterans with PTSD participated in individual music therapy sessions once a week for 8 weeks. The music therapy sessions included a range of music-based interventions, including songwriting, singing, and instrumental music making. The results showed that music therapy was associated with significant reductions in PTSD symptoms, as well as improvements in mood and quality of life after reviewing the post-traumatic stress disorder checklist, also known as PCL-5 results. The PCL-5 is a widely used assessment tool that consists of 20 items that measure the severity of PTSD symptoms, including re-experiencing, avoidance, negative alteration in cognitions and mood, and arousal. The researchers also used the Depression, Anxiety, and Stress Scale, known as DASS-21, which is used to measure mood. The DASS-21 is a self-report measure that consists of 21 items that assess the severity of depression, anxiety, and stress. Finally, the researchers used the Quality of Life Inventory to measure quality of life. This is a self-report measure that consists of 32 items that assess various aspects of quality of life, including physical, social, and psychological well-being. Music therapy has also been found to be helpful in reducing pain and improving mood in hospice care settings. The University of Utah conducted a study that found that music therapy was associated with improved cognitive function in older adults with dementia. Older adults with dementia participated in individual music therapy sessions once a week for 6 weeks. The results showed that music therapy was associated with significant improvements in cognitive function, as well as increased socialization and communication. There are several different approaches to music therapy, including improvisational, receptive, and active music therapy. Improvisational music therapy involves creating music in the moment, while receptive music therapy involves using pre-recorded music to address specific goals. Active music therapy involves the client actively participating in music making, such as singing or playing an instrument. So, there you have it. That's a brief overview of music therapy and how it can be used to help people of all ages and abilities.